Hello, my name is Tiffany. I'm going to be your nurse today. Let me go ahead and hold it shut. Perform hand hygiene. And I would like to verify your first and last name and date of birth. If I can see your armband. Okay, perfect. So Mrs. Jones, what we're going to do today is I would like to get your oxygen started. The doctor put in an order for 2 liters via nasal cannula. So what that is it is just this right here. And what I'm going to do is I am just going to insert these 2 like little prongs in your nostrils, and there shouldn't be too much discomfort, but if you experience any, just let me know. Let me go ahead and get my extension tubing here and connect it. And then I'll connect it up here to the oxygen that I'm verifying on the wall. Connect that. We're going to go ahead and turn it on and set it to 2 liters because that is exactly what the doctor ordered. Okay, so then we're just going to go ahead and insert these here. And it's going to come around your ears like this. Just want to tighten that a little bit so it doesn't move, but you still have the ability to move around. All right, does that feel okay? Any discomfort? Okay, wonderful. So then I'm going to sanitize my hands and document that I began 2 liters oxygen via nasal cannula. And then after the patient has received this therapy for a time and their oxygen levels aren't where we want them to be, I would come back to the room. Hi, it's Tiffany again. I would perform hand hygiene, and I would let the patient know. So per doctor orders, your oxygen levels aren't where we want them to be, so we want to switch you over to this non-rebreather mask. And so what it is this bag here is going to inflate with the oxygen coming from the wall. And that way, when you're breathing, you're getting the oxygen, but if you decide you need to take a deep breath, that extra oxygen is going to come from inside this bag instead of pulling it out from room air, because we want you to get the maximum amount of oxygen that the doctor has ordered, which looks like he ordered for 10 liters. Okay, so I'm going to go ahead and get this hooked up here. I'm going to connect my tubing to my mask, and I'm going to connect the tubing to the extension tubing. And then I'm going to undo the nasal cannula tubing on the oxygen, and I'm going to insert the non-rebreather mask into the oxygen, and I'm going to adjust my flow meter to 10 liters per doctor order. Okay, and so then we're going to go ahead and remove this here out from around the ears. Okay, and I'm going to go ahead and place this mask. We're going to place it over your nose, over the bridge of your nose, and then down, and I'm going to put this around your head here. Okay, and we're just going to pinch that to the bridge of your nose so we get a nice seal. I don't want it to be too tight and cause discomfort, but if there are any areas of discomfort, just let me know. I can take my 2x2 gauze and fold it, and I can put it along under your bands here on your cheekbones if it causes discomfort, or if there's any areas where it feels pinching or too tight on your mask. We can go ahead and place it there, just making sure that we do keep the seal, because we want you to get that delivered oxygen instead of the room air. We don't want to break that seal. Okay, so are you feeling okay? Here's your call light if you need me, and I would allow for the patient to receive their oxygen therapy. I would sanitize my hands and let the oxygen work. And then when their therapy was done, I would come back in, announce myself to the patient, make sure that the curtain's closed for privacy, sanitize my hands, let them know that their oxygen therapy is complete and that we're going to remove their mask. And I would discard of my mask and all my tubing properly. And I would give the patient their call light, make sure they're comfortable in a reclined position if that's what they liked. And I'd make sure their bedside table is next to them. And I would perform hand hygiene, and I would document their response to therapy.